Hello, everyone. We're here today to talk a little bit about lab work, one of my favorite things. So, in functional medicine at Synapse, we always take a look at the body as a whole, mentally, chemically, and physically. And so, with this video, we're going to be talking about assessing the lab work. So, I want to start just with some basic principles here. I'm going to bring up some lab work that we've kind of mocked up, and this will be things not a real person per se, but it'll be someone that we've altered the labs and just to really get a sense for you so you can actually see what's going on here. And so what I want to do is just start with the top here, top left. And generally speaking, when we look at labs, we actually have reference ranges. And in the world of healthcare right now, we're recognizing that the lab values that they make don't really fit everyone. So they're usually an average of the people through all of the United States. So if you look at all of the United States, the majority are pretty unhealthy. And so we want to look at the specifically the values and ranges for people. If you're a female in the 44-year-old range to 55-year-old range, there's slightly different values. And so what we're doing is assessing your optimal levels. Now, if you look at the key over here, you'll actually see that there are some different colors. In traditional medicine, if you're outside of the lab values of traditional medicine, and I'll give you an example of that right here, you're going to see it'll flag it and say below normal or above normal, just like that. So on our laboratory evaluation, that is reflected in the yellow for lab low or the red for lab high. Now, in functional medicine and in a lot of the same research, they also find what optimal levels are, and that would be considered normal. But the ranges are different. So there's this gray zone between the traditional ranges and then the optimal ranges. So people will be in that gray zone and they'll dive in and dive out of that for years. They'll have symptoms, but no active disease. So on this laboratory evaluation at Synapse, we'll actually assess the labs and see what is lab low or lab high, indicating there's an active disease process already started. In which case, sometimes we have to refer out if medications are needed. We'll sometimes prescribe the medications for surgeries, things like that. In the traditional world, we will make referrals for that. However, many times, if it's in the functional low or functional high range, indicated by the pink and orange colors, then there's quite a bit you can do with diet and lifestyle changes. And you will be shocked how you can actually discern through this and start to see patterns. Now, after a while, you can get your first baseline. That's called result number 1. And you can see after a while, you can start to compare results and see if gains are being made by changing diet and lifestyle. That'll look something like this slide, where this is result number 3. And we can see with this person that they've made some had some changes, and some things can be reflected, but they had testing done in 2017, testing done in 2019, testing done in 2020. And his name isn't really John Doe. But this is just some numbers thrown in there just so you can see what can be optimized. And here at Synapse, we have a saying, don't let age be your cage. And we can take a look at these values annually and start to make changes with diet and lifestyle and keep things really, really working much, much better at an older and older age. Now, the beautiful part of this is that there is quite a bit of a discount with the companies that we work with. So we've negotiated with them and worked with them to discount these quite a bit. So give you an example, our current panel that we're going to go through right now, when run through health insurance, oftentimes will be between $1,200 and $1,500, and ours will be around $206. So it's about an 85% discount is generally what we have been able to get. So you're going to get a lot of information. This is by far our most requested and common lab that we run. And it's because of all the information that you get and because of the value with that. So many times people will get the lab and go through the evaluation with the doctor and then submit that to their insurance and still get it covered. But you're talking about an 85% discount doing it this way. So everyone likes to save a buck, right? And there it is on this one, our best value. So let's just start here in the beginning part of this. When it comes to how the body works, the first and most important thing is oxygen. We'll get to that a little bit later in the testing. The second most important thing is blood sugar. Our cells need oxygen and proper blood sugar balance to work. So in this first test here, you can see the first two markers are glucose and hemoglobin A1C. And those markers are off functionally just a little bit. So when we take a look at those, that glucose, and then we scroll down to the carbon dioxide can be low when there is dysglycemia or blood sugar regulation issues. And with a functional low blood sugar and a normal hemoglobin A1C, we can assess this person for reactive hypoglycemia. So if they eat a high sugary food and then crash 2 hours later and need a nap, that's a sign of reactive hypoglycemia. So that allows us to see in their blood work and measure, especially if there's consistency with repeat labs, how well you're doing to manage that reactive hypoglycemia, which is very common in certain genetics. It can also interfere with sleep and overall brain function, like foggy brain, things like that. And also, when the blood sugar drops too low, we can start to have hypoglycemic reactions like being hangry. And if the hemoglobin A1C was below 4.8, then that would be a true hypoglycemia. And we'd want to do things to curb the hangry episodes, if you will. The next markers are generally looking at kidney, but I want to highlight the uric acid just because we do see this one quite commonly. Most people know this one when it's above 7.1. It can turn into and help diagnose gout, especially if you have the pain that is associated with gout. However, functionally, we see this one off quite a bit when we see and have identified leaky gut. Arterial sclerosis can cause a buildup of this type of acid, and potential mold or fungal exposures can also increase your uric acid. One other common thing that we see is low stomach acid tends to yield eventually higher body acids. Uric acid is just one of them. There are other lab tests, like an organic acid test, that can actually measure these other acids. And so measuring the acids in our body and keeping them in range is a great way to give us an idea of, number one, are we healthy? But also, number two, what might be causing those acids to go high? Now, most acids in the body have to be taken out of the kidneys. And here you can see the BUN, that stands for blood urea nitrogen, and the creatinine, along with the EGFR. These are all signs of kidney function. If they're out of range, your kidney can get pretty stressed, and then we can start to get a breakdown of whether or not you're in stage 1, 2, 3, or 4 kidney failure. The BUN itself, though, when it's low like this, can be a sign of pancreatic insufficiency, meaning you're not producing enzymes, or low protein. When you compare it with other aspects of the lab test, that's when we start to see that a pattern develop. So let's scroll down here, and we can actually go down to the total protein. And that one is quite low, which is a sign of hypochlorite. Hypochlorite stands for low stomach acid. So low protein might be coming from the fact that they're just not digesting the protein that they're eating. So when we see this, we ask about their diet and how well they're doing with it. Hypochlorite can also influence absorption of key vitamins and minerals, including, but not limited to, calcium, iodine, iron, the B vitamins, especially B12. The magnesium is another important one. These need good stomach acid to be absorbed. So we move forward a little bit and we can see that the creatinine is very low here. We do see that with people with small stature. So if this particular 44-year-old female was small in stature, then that could be part of it. It can also, and this particular one, it was not small stature. It was a process called methylation issues. They had issues with their methylation, which can be verified in other lab tests that are coming up further along. So we start to see processes, and I'm going to talk a little bit more about methylation when we get to a key marker later on. We know these are not because of poor kidney health, because the rest of the kidney markers are doing really well. That means the kidney is working hard and holding up, but we've got these precursors that are showing dysfunction. So for us, the true way to prevent disease is to measure the breakdown in communication well beyond and before, I should say, the disease actually occurs. And that is really the premise of functional medicine. All right, let's move down. And we can see, as we said, the carbon dioxide is most likely because of the dysglycemia, the reactive hypoglycemic, or the metabolic acidosis is started because of the inability to clear the acids out of the body as efficiently. We can start to see the uric acid, that's just one of many, start to rise. We move down and we can see there's quite a bit of functional problems here. And we see calcium is a little low. Now, when calcium gets too low in the blood, it will start to pull from the bone, which that is what we call osteoporosis. So normal stomach acid is really important for absorption of the calcium that you're consuming in your diet. And most calcium comes from our green leafies, not necessarily milk. We have a whole section and we'll be talking about calcium in other podcasts. But for this one, we want to just make sure that the calcium in the blood is from not from other factors. So parathyroid dysfunction can cause it. The hypochlorite or low stomach acid, like we said, could cause it. Thyroid dysfunction and vitamin D excess can also cause that. Now, the next couple of markers here, all of these down to the AG ratio, show that the lack of stomach acid, hypochlorite, has had some consequences. So phosphorus has dropped low. We would want to differentiate between whether or not this is a true parathyroid problem, but with low calcium, that usually is hypoparathyroid. With low phosphorus, that's usually hyperparathyroid. So that tells us it's hypochlorite or low stomach acid. The bottom line is the doctors tend to look at these labs and can discern based on your history, physical exam, and now looking at the patterns in the blood work when you get it all at the same time, truly what's going on and what to correct. Now, in the traditional labs, the only one that would have been red flagged is your AG ratio, which they may have chalked up to the thyroid or some other problems, but not necessarily put everything together because you're not looking at the patterns within the blood work. In these next sections, bilirubin is a great marker for us to get a sense of how the red blood cell to heme and hemoglobin is working. Your alkaline phosphatase with kids, you will see this enzyme really start to get higher when there's bone turnover. Let's get into some of the other markers here right now. LDH is an enzyme that gets elevated whenever there's liver dysfunction, but as you can see in this lab test, the liver enzymes are normal. AST, ALT, and GGT are all normal, so this person's liver is doing pretty well. LDH can go increase with cardiovascular disease, anemia, B12 deficiency, tissue destruction. Just like if you get a sunburn and your skin flakes off, if there's inflammation in the body or damage to some of the cells, it will flake off just like that, and we'll see this enzyme increase. So viral infections can do the exact same thing. So this is an important enzyme. When it gets above 230, 250, we can start to do what's called an isoenzyme test to determine what organ's actually flaking off, because it is organ specific. So that becomes a very helpful, useful test for us. And again, I just want to reiterate, the whole purpose of getting a functional evaluation on top of the traditional one is to determine the progression of symptoms and how healthy you are. And by addressing this, you can start to push back a lot of the health challenges. And we've been doing this now for over 15 years with success, and some of the changes we've seen on the lab work and in the people has just been phenomenal. The next sections here, we look at iron. So iron is very important as a marker for just in general inflammation. It also can tell us quite a bit about anemia, because hemoglobin, which we'll get to later in this test, is made from 4 iron groups. And so it's very important to have normal and balanced iron. We need good stomach acid. Iron will go up, though, whenever there is inflammation. There's a genetic process called hemochromatosis, and that will push your iron and ferritin levels up quite a bit higher, your ferritin more so, quite a bit higher than these markers. Usually people will be in the 6, 7, 800s when they identify hemochromatosis problem. Viral infections will also increase iron, as will different things like lead toxicity. And so iron becomes a very important one to look at. And a lot of people with anemia or fatigue, it's because they're not using their iron because of inflammation. In this case, if we skip to the hemoglobin down here, we can see the hemoglobin is normal. So this person, they have high iron, and normal hemoglobin. So really it has to do with inflammation. So we know right away that their fatigue is not coming from an anemia, but more from an inflammatory perspective. So we have to identify what's causing that inflammation. In this person, we can see also that their cholesterol is right here, and the cholesterol is high, and a lot of times that gets flagged and can be a problem. The triglycerides, though, are actually in a good and normal spot. That's a good sign. That tells us this person is eating a decent amount of carbs, or they're transitioning through a process. Their good cholesterol is really good, and their bad cholesterol is too high. So their ratio is really good. Now the HDL is cardioprotective. So with this person, because the ratio is really well, we don't truly think there's cardiovascular problems. However, anytime we start to see the good cholesterol get above 100, that's a reaction to something. And so we are really looking at what is causing the damage to the cardiovascular system. It can be extra oxidative stress from extra exercise. There can be a genetic disorder. It can be autoimmune, which is being triggered by environmental toxicity, infections. It can be estrogen or steroid use that's causing their cholesterol to get out of balance, or severe thyroid disorders. So we want to pay attention to those still. So even though the heart is doing okay, it's important to pick out these little indicators. And in nutritional lab work, that would not get red flagged as an issue until the autoimmune is already there, which is very, very common. The next marker that we see is C-reactive protein, and this is a great marker for any type of inflammation in your system. It can be high from arthritis, irritable bowel disease, vasculitis, tissue infarction or damage. That one's common too. Soft tissue trauma or inflammation from that, bacterial infection, even cancer can be one of the causes for the C-reactive protein. If yours is high, don't think cancer right away. That's generally not the case. We see people with reactions to wheat, dairy, dysbiosis cause these C-reactive proteins. A lot of times when we fix the digestive tract and the sleeping, then the C-reactive protein improves. A lot of these people are also very, very deficient in omega-3 fatty acids. And so by improving your anti-inflammatory process, we can improve the C-reactive protein. If it's arthritis, then we look at the underlying causes of that arthritis. If we have to fix leaky gut and autoimmune scenarios, or if it's degenerative in nature, we need to look at the best way to support that. So multiple ways to do that when we compare with the rest of the test gives us a lot of good information. Homocysteine is the next one. And this one's a very interesting chemical. When this one gets built up in the body, it can actually induce a heart attack. In fact, many times you'll read about basketball players who are 17, 18, 19 years old who dropped dead of a heart attack on the basketball court. A lot of times it's because of this particular chemical, homocysteine. Homocysteine requires methylators, and we saw earlier with the kidney test how there's a problem with methylation, and can be a problem. And so methylators generally do a couple things. Methylators help protect the heart, which basically they do that by converting homocysteine, and they help in the process of making neurotransmitters like serotonin, dopamine. So a lot of people have depression, sleep disorders, anxiety with the homocysteine elevation. It also helps the liver detoxify and helps protect your DNA from cancers. So when we see one of the 4 tests being elevated, we really want to make sure the methylation is being supported. If you see 2 like we have, then that's a definitive sign that we have a problem. Some people have a genetic inability to convert methylators like folic acid efficiently. That's the MTHFR defect. And so generally speaking, we want to support these people with the B vitamins. Sometimes we use other things, other methylators as well. Betaine, HCl to help the hypochlorite. It can also be used as well as other factors to support methylation. So this one we want to get down between 6 and 7 is optimal. Anything over 10 actually increases your risk of a cardiovascular event, including stroke. Let's go on to thyroid here. And with the thyroid, we want to get a full panel view. So that includes TSH all the way down to the thyroglobulin antibodies. This is how you assess the thyroid. Very important to take a look at the entire big picture. TSH is basically your brain's perception of how much thyroid you have. This 1.35 marker is in range for the classic. And again, in today's world, in the healthcare system, we're starting to recognize that not only is there different values and optimal levels for thyroid, depending on if you're a male or female and what age you are, but even what part of the country you live in. So we're starting to get to that level of understanding as far as the thyroid itself. In this scenario, we can see that T4 is in normal range and T3 is low. So the brain has a low normal TSH or functionally low TSH, which means the brain thinks there's too much thyroid, but the actual amount of thyroid is low. So this person will come in with symptoms of hypothyroid, and if they just get the TSH, the doctor will say, well, you have hyperthyroid. There's no way that your thyroid's in trouble. But the reality is they're making enough T4. They are not making enough T3. They're making an overabundance of reverse T3. And there is another video on here that you can watch specific for thyroid that talks about how reverse T3 blocks the normal thyroid. So it's basically dysfunctional thyroid. And also we have down here at the bottom, thyroid peroxidase antibodies. So these are antibodies that are possibly attacking your thyroid and or thyroid hormones so that you can't use them. So if you're making enough thyroid, but your body's not using it, it still counts as hypothyroid. We call this secondary hypothyroid. But if the doctors just run a TSH, they're not going to catch that. Or if they just run a TSH and a free T4 or free T3, they're not going to catch that. So there's a lot of confusion in that world. And check out the other video so that you can get the information on how T3 and reverse T3 play off each other. But generally speaking, this person is going to be now being addressed for a secondary hypothyroidism. And we see how does that relate to their physical findings and what they're reporting, and also the possibility for Hashimoto's or autoimmune. So we'd want to investigate that. One of the things we tend to see with autoimmune is dysfunction with the most important hormone for immune system in the body, and that's vitamin D. And that's the very next one here. And this is very low. So that is consistent with autoimmune. Omega-3 deficiency can be tested, as that is also a very important factor, as can glutathione. Historically, one of the patterns we see is with hypochlorite and the low stomach acid is a white blood cell count that is low. This is your immune system response. We do see this with chronic infection, with autoimmune, and again, some of the pancreatic insufficiency or enzyme problems. We need to break down our food so that we can build up and make our immune cells, our globulins, our immunoglobulins, and also we need to be able to feed them. And so in this scenario, we can see that this has been going on for quite a while with the chronicity, and the immune system response is not quite there. So when we can compare this to other findings, we really get a lot of information. Some of the other markers you'll see indicate some other B12 or iron deficiency issues. We know in this case it's B12. Lymphocytes, again, chronic infections, we'd be investigating that. Eosinophil percentage, really high, and that is an intestinal parasite, food allergy, sensitivity, or asthma problem, and that's consistent with some of our other findings. So with this person, we're definitely going to be working on fixing the GI tract and getting them sleeping if there's a sleep disturbance. With the absolute eosinophils too, that tends to lean us toward the parasite scenario. And so this, as you can see, gives us a lot of the insight into the body from one test. So for us, this is one of our most valued tests because in an instant, in a very cost-effective way, we can get a glimpse into the entire body and see what's working, what's not working. Now, there are thousands of other lab tests that can be run, but this helps us zero in, especially with a good history and a good physical exam. We can start to zero in on particular problems and start to correct them. So I encourage you to not only get your test done to give us a lot of information, but also get the follow-up tests. See how your diet and lifestyle changes, possibly medications, have improved the overall function. Or if you start medications and see that they're actually causing some level of side effect or dysfunction elsewhere, then it's important to know those as well. We love this test. This happens to be my favorite test, and I absolutely get this done for myself and recommend the majority of my patients to get this done as well. So thank you for watching. Yours will be unique to you, but when we go through it, you will be surprised and shocked at how much value there is to the program. We have a full book that we've put together of all the different variables that can occur with this entire process. So every part of the lab assessment, every year we're adding different variables that we actually can measure, and we're seeing patterns. Even during chronic flu seasons or infection seasons, we start to establish patterns that they see, and these markers will help tell us what we need to work on to prevent these problems in the future. I thank you for watching, and I want you to just take full responsibility for your health and what you put in your mouth, and the lab work will help validate that. Thanks so much, and enjoy your healing journey at Synapse.